Thank you for asking me to speak at your conference, World of Care and Repair, and the Alliance Group. Thank you very much for that. I hope you've had an interesting set of speakers so far today. I'm bringing a different angle, perhaps, to the current situation for all of your organisations in building mental resilience in a COVID-19 world. You'll notice that I haven't said a past COVID-19 world because I'm pretty sure that COVID-19 will be here with us for quite some time to come, both the infection and its legacy. My name is Munna. I'm a practicing occupational health consultant. I see patients, I advise organisations, I teach and educate in terms of occupational health and well-being, and I'm particularly interested in relation to mental health and how that affects both individuals and the organisations that they make up. So what I thought would be helpful today for our talk is to look at the COVID-19 pandemic journey. The journey that we've all been on. Some of us have been on slightly different pathways along that journey, but certainly a journey that we are still on, although I'm pretty confident that we are nearer the end than we are to the beginning. I want to talk about the pandemic effect on mental health and well-being, what has given rise to that, and what the clinical effect of that has actually been. And then I think we're not reinventing the wheel here, but it's very important that people know we're going to get back to the basics for mental well-being, and I'm going to have a few resources that you'll be able to plug into. Certainly some of these resources will be available. I know it's a worldwide audience potentially, and of course these are all accessible online as well for people to look at. So I thought it was really important to look back really at the timeline. This COVID-19 pandemic happened quickly. We actually had our first inquiry in relation to COVID-19 way back in January 2020, when I think most people were still thinking that this was a situation that had arisen really in China and was at the other end of the world as far as the UK and Europe are concerned. But actually, we had a client who deals with international airline travel, and they had started inquiring about COVID-19 and how they might mitigate and manage that situation. And although we gave advice in relation to that, I'd have to be honest and say we didn't really believe it was going to be something that would affect us here in the UK. Now, of course, the public health message changed quite dramatically. It went from low to moderate risk of threat to public health here in the UK. Obviously, we were seeing images at this point in relation to Italy, Lombardy, and then the extension of that. And then almost suddenly within the UK, we had Boris Johnson notifying us of the stay-at-home requirement. And after that, the timescales are actually, the timeline is actually quite interesting. So the first wave really we thought had largely ceased by the time we reached sort of early June, end of May, certainly. That was our first 40,000 COVID-related deaths milestone. That's, of course, people that we knew about who were COVID positive. Of course, we know that there are far more excess deaths than those that the numbers will identify. I think really we just limped on really with no real hope of outcome until the news of the Pfizer vaccine. And that news came out in November. And of course, the first vaccine from Pfizer was delivered in the UK on the 8th of December. And that certainly heralded a more positive outlook for society and for organisations and the world ultimately. And then, of course, we had good news about the Oxford AstraZeneca vaccine pre-Christmas, but the actual vaccine programme, again, began using Oxford's AstraZeneca on the 4th of January, when everyone came back from the festive period, on a background of a new lockdown and, of course, rising levels of COVID-19 infection and the threat of the then called Kent variant. By the time we reach 16th of January, we have 100,000 deaths relating to COVID-19 in the UK. And just a couple of days ago, 20th of February 2021, death toll in the UK, 126,000. Now, of course, the real death toll will be significantly higher than that, because this is simply confirming those with a positive COVID test in the 28 days prior to death. And of course, we have to remember this is a pandemic, i.e. worldwide. Many of you will be in other countries potentially around the world, and 2.71 million is the WHO figure. But of course, large numbers of countries will be woefully underreporting in terms of COVID-19 deaths. So a huge underestimate, no doubt, in relation to COVID-19 worldwide deaths. So we can all recognize the rough timeline here. Certainly it's the way I see it at the moment. But of course, there's a lot of positives now, which we'll come to shortly. So although people have been worried about the physical effects of COVID-19 infection, there's no doubt the pandemic challenge has been in relation to people's mental health. And I suppose it's not rocket science, but worth just recognizing where those challenges have additionally come from. Why is this different to the normal challenges that people have, and of course, which are still continuing in the background for those individuals? So no doubt we've looked at the death toll here, increased bereavement. Most people will know somebody who has been affected by death from COVID-19 infection. So certainly increased levels of bereavement. And of course, earlier on in the pandemic, there were also difficulties and challenges with regard to funeral arrangements, being there when loved ones have died. All of these factors have increased the burden from bereavement over and above the normal situation that of course is. Human beings rely on social contact. We are social beings. We take part in regular exercise, or we take part in hobbies, interests. We meet friends. And these are all the upsides in day-to-day life that helped us cope with the downsides in life. So you can see how people who are cut off from social interaction with friends or can't take part in the hobbies or interests that they enjoyed, how that can feed into that negative effect of mental ill health. There has been a lot of job loss. Remember, I'm trying to think of this more widely than simply the UK. The UK has done reasonably well with the furlough scheme, but even with that, there have been substantial job losses along the way, and no doubt more to come. In other countries around the world, the economic impact of COVID-19 has been enormous. And we know the adverse impact of job loss on health and well-being, both physically and mentally. I also believe that many people, and some of them still do, live in fear of infection. Fear that if they catch the illness, or if a loved one at home with a vulnerability catches the illness, that they will be severely unwell and could die or be admitted to hospital. So all of these are angsts that people have carried, and all of these are psychosocial factors that have increased the risk of mental ill health amongst us. And of course, that includes us as individuals, managers, and employees of organizations, as well as the households in which you might carry out some of your work. So this is an interesting study. This is a paper that was looking at the mental health effects relating to the first 2 months of lockdown back in March and April 2020, well, April into May. And I'm just going to illustrate a couple of examples, and you can see the magnitude of the impact relative to pre-COVID times. So this is a survey from the Institute of Fiscal Studies looking at by age demographics. You can see there's a blue line, a red line for the middle age 35 to 64, the category I'm in, and the 65 and overs who are in the green line. So certainly one of the key things we see here is an increase in all age groups in terms of a lack of enjoyment in day-to-day activities, so a loss of pleasure. And interestingly, if we think about the symptoms of formal depressive illness, for example, lack of enjoyment or loss of enjoyment in day-to-day activities is one of those symptoms. What we also see in this next slide is the same study looking at whether people felt unhappy or depressed. Of course, there's a big difference between being unhappy or clinically depressed, but often clinical depression is preceded by a period of unhappiness. But again, you can see a substantial shift there in terms of happiness in both men and women, and particularly in the younger age demographic, the 16 to 34-year-olds, because of course their source of pleasure and happiness tends to come from more social interaction, socializing, the things that have been particularly closed down. You notice that that sort of older men tend not to have varied particularly post-COVID on this parameter. Women tend to have, again, there are some sort of social issues around women perhaps being more sociable in general, and this therefore curtailing their ability to take part in the thing that they had positivity from. I think sleep is a very good indicator of underlying health and certainly well-being. We know that poor sleep is strongly associated with less good physical and mental health. And we can see here in particular younger women and middle-aged women have had a significant increase in their sleep disturbance, which generally sits higher than men at the best of times. So there's no doubt that there are some parameters in relation to poor mental health that are adversely affected, both in terms of gender and also age group, with younger women and middle-aged women perhaps being more adversely affected by the consequences of COVID-19, at least on this study and relating to the first lockdown period in the UK. So there are no doubt that there are psychosocial challenges for a return to the workplace. Certainly in the UK, we have the route map or roadmaps out to a return to work. At the moment, the position has been for a number of months post-Christmas 2021 that we should all be working from home where possible. So we've got some challenges here in trying to get our economy moving and back into at least a normality similar to where we were before. The psychosocial challenges are actually pretty straightforward. Many of you will have felt these yourselves. I know I've felt some of them. Certainly a fear of COVID-19 infection, and I'm meaning about coming back to the workplace and catching COVID-19. It's an understandable fear. Of course, we didn't know in March when there was an awful lot of COVID-19 infection in the community. We just didn't know. Whereas now we've got a better handle and better prediction models of COVID-19 prevalence. So there's no doubt that compared to being at home, being in the workplace is going to carry some increased risk there. So definitely one of the barriers to individuals coming back is a fear of COVID-19 infection themselves. As the vaccine program proceeds, of course, the risk from that goes down substantially, even after a single vaccine. Some people have difficulties with commuting again. I'm not meaning simply the catching of COVID on the bus or the train to work. I'm meaning in the sense of the impact that that can have on their work-life balance. Many individuals will be saving perhaps an hour and a half, 2 hours in terms, or more actually, in terms of commuting time. Whereas now some people talk about the 30-second commute to their computer in the corner of the living room. So commuting again will create challenges and pressures on life again, although they will be more alleviated now that schools are now back, and that can certainly help with the childcare routine. There is no doubt, and we know this in occupational medicine anyway, from long-term sickness absence from work, that individuals who lose that working routine that has a significant impact on their confidence and their ability to resume work tasks again. So certainly a loss of working routine that furlough has caused, because remember, furlough required people to do nothing in the early stages, mustn't interact with work. So we really are talking about a large percentage of the working population, certainly in the UK, who were compelled to not be at work for many months, some of which is continuing still. Of course, so the other side of that is some people quite like home working. They like the fact that they're in the comfort of their own home, might not like the social interaction with colleagues, may have poor relationships in the workplace with some colleagues, all sorts of reasons why. So that change from this comfortable home working arrangement for them might be a challenge. We do know that individuals who have been at home might have developed some more unhealthy behaviours. Now, of course, some people might go the other way. Joe Wick's exercise classes from very early on or similar. But of course, we do find that people tend to be a bit more sedentary, maybe eating or consuming alcohol a bit more than perhaps they would like to, those lockdown pounds that people have developed. So there have been a lot of reasons why. And remember, at large societal levels here, that there are psychosocial challenges that are going to affect people's mental health and well-being, particularly in relation to coming back to the workplace. So let's look at some of the specific stressors. These are really issues that employees raise with us as occupational health doctors when we are assessing people and assessing fitness to return or trying to demedicalize situations that people present with to their employer. No doubt, and particularly early on in the pandemic, worry about not only oneself, but worry about vulnerable family members at home, bringing COVID-19 back to them and ultimately potentially killing that loved one through that infection. Now, the good news that we have certainly in the UK is a very high proportion of the highest risk individuals have been vaccinated, at least with a single vaccine. And if we bear in mind that a single vaccine after approximately 3 weeks can bring sort of 75% reductions in symptomatic COVID-19 risk and greatly reduces hospitalization and ultimately death as well for some people. So we do know that these sorts of worries will be helped a lot by the vaccine program that we have undergone. Job insecurity, I think that furlough has protected many people from that, although I think a lot of people do in the background worry about the prospects of them getting back into work. And this is particularly so in the younger population who tend to do jobs that are a bit more insecure anyway, and tend to be heavily focused on the hospitality industry, which has been severely affected by the COVID-19 pandemic. We've seen a few other psychosocial issues as well. We have seen people who are worried about being put in harm's way or actually feel aggrieved that they have been put in harm's way. There's no doubt there was two camps at the beginning of lockdown. One was those who had to come to work because of the nature of their jobs, be that healthcare, public transport, and those who could work from home, sort of many of the other occupations. And there's no doubt that we had a lot of consultations where people perceived huge injustice from the fact that they did have to go to work when others could be at home, of course, on furlough at that point. And actually not being furloughed, not being chosen for furlough has often been seen as a stressor for people, i.e. being paid in the UK 80% of your salary for being at home and not working versus 100% for potentially being put in harm's way and working. And the move to even working from home has this impact because we've had individuals who have had it's definitely harder for them to work at home, although they are collaborating over new technologies, just like we're using Zoom now for this presentation. You know, all of these issues have been a steep learning curve, and people have just found work a bit harder than usual. Now, as an occupational health doctor and as an occupational health service, we have some clinical challenges for a return to the workplace. One of the key things is assessing health vulnerability to COVID-19. Now, many people want to understand the risks of them returning to the workplace. Am I going to catch COVID through the duties of my job? Am I going to be severely ill or die as a result? Actually, a group of occupational health physicians and epidemiologists created a tool called COVID Age. And this is a tool that's available on the internet if you were to Google that. COVID Age was adopted by the Scottish Government as an excellent tool looking at things like health and demographic risk factors for the development of severe COVID illness in the event of infection. So that looks at things like your age, your gender, your ethnicity, and underlying health conditions and how well controlled. So certainly individual health vulnerability has been a real challenge for people returning to the workplace. And I would urge any workers who have any concerns or any of your employees about returning to the workplace that they consider looking at their own health vulnerability. And very often the evidence-based individual health risk is much lower than they perhaps perceive. We also have to consider how that is going to be modified by lower societal prevalence, because if there's less of it about, there's less risk of you catching it in the course of your work, and therefore less risk of being ill. And let's not forget the key moderating risk factor, which is vaccination, which greatly reduces risk for almost all cases. There's some debate as to whether the extent, to which immunosuppressant conditions would be benefited by vaccine, but certainly likely to be lower and still worth vaccinating, no doubt. We've also had those individuals who already have active mental illnesses. I am definitely aware of cases of people who were progressing and improving, were accessing appropriate mental health services, they had good social contacts and structures, and these all overnight fell away and they have succumbed to downturns in their mental health when otherwise it would have been clearly predictable that they were going to be absolutely fine otherwise. So no doubt there's the active mental illnesses that were already existing. And of course, we've got new active mental illnesses that have occurred because people's resilience has been affected. We're seeing an increase in long COVID, which has both physical and mental health and cognitive impairments, which can be quite a significant impact on individual recovery, and not only in those who were ill or hospitalised or ventilated. In fact, we're seeing far more of this in community-based cases. We also have got well-being impacts for those who are awaiting treatment. Again, from clinical experience, we have many patients who are off sick, who are in chronic pain, who have got lowering mood as a result, who are awaiting treatment, who are waiting for a hip replacement, waiting for the knee replacement, waiting to see the cardiac specialist. All of these extra long waits that individuals have had because of the impact of COVID-19, and that creates both a physical and a mental burden for them. And of course, we have people with new major diagnoses, either ones that they have found or ones that they have not found yet. And of course, we are aware of individuals who will not have come forward yet with their cancer-related symptoms and consequently may die or have a much more protracted course or need more aggressive treatment. So there are no doubt lots of clinical challenges affecting both physical and mental health for society as a whole. And of course, that's made up of also workers within your organisations. So I think it's important that we don't get too overwhelmed by that. And I wanted to focus on just some things that you could take away as individuals and as managers. So here are some management basics that I think would be appropriate for helping your organisation navigate through what ultimately will be a return to work plan. So I think the practical step has got to be one of leadership. Communication from the top, being in communication with your workers well, communicating often. I think that's really important as we're trying to transition people from where we have been into a world where actually people are getting more back to normal and are resuming activity and interaction like before. Remember, we've had a year of substantial limitations in how we live and work, and I think that has been very unsettling for all. It's important to still keep your work teams in touch. Now, I think that a lot of organizations are looking at hybrid models going forward, where there'll be some time in the office or some time in the depot and some time working remotely. But I think there's a big difference between an email and a phone call or a video call with people. And a lot of organizations will have this well in touch, but certainly keeping in touch with your team with that human connection. If we consider that, or particularly upon a return to work, many individuals are worried about new infection or worsening infection transmission. Certainly reviewing your risk assessments regularly and communicating these will help to reassure workers. And generally speaking, certainly in the UK, as societal prevalence goes down, better treatments for COVID-19 itself, as well as the impact of vaccination, are likely to reduce absolute risks for individuals quite considerably. But let's not forget the basics, and the "are you okay" question is not just for COVID times, but it's certainly very important in COVID times because of the wide-ranging effect of COVID-19 on mental well-being that we've already touched on. Remember, staff might not want to come forward with concerns or worries. They may be worried about their own jobs, as we've learned about many people are. So certainly encouraging people to raise worries and concerns, because often the worries or concerns can be easily managed. It might be a risk assessment issue. It might be, okay, you don't do that, we'll do this instead. It might just be a simple flexibility that we can provide that could alleviate and prevent that worry building up in the worker, who subsequently then might go off sick. And then we've got to deal with the recovery and the return to work instead of trying to head these things off at the pass. Many of your organizations will have an employee assistance program, or you might have a trade body or a private medical insurance, or you might have a cash plan provider, someone who's got an employee assistance program. So definitely make sure that you're paying for it usually anyway. Make sure that is well promoted within your organization. Certainly get staff to take their breaks as normal, even if they're working from home. The tendency might be that I'm going to keep going, get that bit done, or even worse, people that are picking work up, putting it down and picking it up again later on in the day or the evening, and certainly trying to keep that work-home separation, if not physically, at least in time. And certainly some ergonomic issues can be arisen from very poor ergonomic setups at home. But I think it's important that we focus on individual basics. The individual basics haven't actually changed, and they are just more important than they ever were before. And that's for you as people managers or managers in organizations, as well as the individual employees that make up your organizations. So what should everybody be doing? And I would argue these would apply with or without COVID, to be fair. I think it's very important that if people do have symptoms that are more than feeling down or a bit unhappy, or actually depressive illness or anxiety, very important that they seek medical input, because we know how effective medical treatment is for these medical conditions, often within just a few weeks. Maintaining social contact with friends, recreation. We're now able to meet people outdoors in the UK. So certainly being able to take part in that human contact is very critical for helping us with our resilience and coping. Certainly talking about worries, taking part in exercise. Now, of course, many people have learned lots of things, new languages, how to play an instrument, all those things. One thing that I think anyone with time could learn to do, which is to learn mindfulness, to learn how to clear out those worries in one's head. And there's lots of ways of looking at mindfulness, be that some of the books or online courses that are free or fairly minimal in cost. Most employee assistance programs will have some mindfulness information there as well. And fundamentally, sleep hygiene. I think there can be a tendency for people, particularly if you're not traveling into the office to work, for them to stay up later and wake up later and affect the routine that we have. And I think that's going to be more of a challenge as we come to the lighter season coming up. So I'm going to just end with a couple of slides. Again, these are online, so those of you who are not within the UK should still be able to access these resources. Living Life to the Full is a well-developed online mental health CBT self-development course, free of charge, accessible online. They've got very specific guidance on COVID-19 itself. And interestingly, you saw what I said about mental ill health, particularly in youngsters. So for younger people, there's a specific section for them. And I would certainly urge that to be available to your employees within your organisation and yourself, of course. And here we've got the NHS have tied on with the charity Every Mind Matters, and there's some excellent resources there in relation to mental well-being, pretty much what we've spoken about already. What are we doing as clinicians? Certainly the Royal College of Physicians and Surgeons of Glasgow, where we are here. Certainly we've been focusing on our own mental health as well, because certainly the clinicians that have been dealing with the difficult challenges have been given this guidance and advice from very early on. And I would say that there's no reason why this would not also apply to your own workers who throughout the pandemic may have been going to people's homes, doing essential repairs, providing social care to vulnerable individuals, all of those things. So we certainly have been promoting that self-care element that's important here. But I think it's really important to end on a genuine positive. We've talked about the negative impact of the COVID-19 pandemic on society and individuals. But this is not just an issue of one-way traffic, i.e. only bad, only downwards. We have a huge opportunity here for positive psychology, or the mental health bounce, as I like to think of it. We, having been denied the ability to freely do things that we took for granted, I think that we are all going to take pleasure in ordinary things, everyday things that we haven't been able to do on a whim for the last year plus. And I think that ultimately we might, as individuals in society, be far more content with everyday things and happier with ordinary pleasures. And that can have a huge impact on anxiety and feelings of mental well-being. And fundamentally, I think humans are quite resilient, and we will try, and I'm pretty sure that we will as a society bounce back well from this COVID-19 pandemic. So I can see this as being having some positives as well, although it's quite hard to see them all the time, but I can certainly see us moving into a position where things are better. So I hope that's a big sort of whistle-stop tour through how I see the COVID pandemic situation, and importantly, how you in your organisations and as individuals could try and improve the mental well-being for your workforce and ultimately your organisation. Thank you.